The most common issues I see with patients before coming to total arch, a lot of broken teeth, missing teeth, large swellings and abscesses. There's a real big connection between the mouth and the rest of the body. You see a lot of just swelling in the mouth too as well. A lot of times when I see the patient's initial conditions, I actually feel fairly bad for them. You know, some of them are on the younger side, so you see them and their confidence is gone. It's tough for them to eat and chew. So it's kind of sad to see, to be honest with you. I really refrain from judgment as to how you ended up in a situation where you might be considering full arch dental implants. Sometimes it's as simple as teeth started breaking on you. Sometimes it's just a question of putting yourself last because you had a family to raise. So there's multiple different reasons as to why we might be at this juncture. To reassure you before your appointment, if it's a big day, if you end up going through with dental implants, I mean, you can always call and text me because you have my cell phone. Sometimes I reach out to you myself personally just to make sure you're doing okay and on the same page. I've even went as so far as to walk out to the parking lot to help you out of your car and into the office on the day of your procedure. So if you want, usually you're sedated for the procedure. So the anxiety is kind of taken out of that scenario, because you're not going to be awake. But if you're really anxious about coming to the office in the first place, sometimes we can give you something at night to help you sleep. The staff is here to help. Allie's been with me for many years. You know, Eve's been a great addition to the team as well. They're always here to answer your questions, and if they don't have the answer, they can always come and ask me, or you can ask me. Recovery after you go through an all-on-X procedure, everybody heals a little bit differently. In terms of the pain and swelling, it usually peaks about 48 to 72 hours afterwards. All your medications are called in ahead of time, so you have them. So the day of the procedure, you're not scrambling to try to go find them. You have a written instructions sheet. I'll give you a call usually that night to see how you're doing as well. The biggest technology boost for me is the three-dimensional x-ray. It helps give me an idea of your anatomy and bone availability. The intraoral scanner we have, that gives us an idea of smile designs. We can do a pre-design so you have an idea as well of what things can potentially look like too. And the technology helps because it takes out the guessing. It helps plan where our implants are gonna go, gets an idea to make sure you're safer and you have a more efficient recovery and a better lasting result. Things that make me feel good about the work is when we kind of come to that end and they have the zirconia in there and we can kind of see where they were when we first met, and to now they have their final teeth in there and are eating steaks. And the coolest thing is patients are able to eat and chew and have experiences they weren't able to have before. Either it was anxiety or just purely unable to function. Going out to dinner, not having to take your teeth out or have your teeth moving around and worry that your friends can see your lettuce stuck behind your denture, you know? So that's kind of cool. The message I have for patients coming to see dental treatment, it can't hurt to have a consultation. There's no obligation to do anything. Again, I'm just want to give you enough information for you to make a good decision for yourself and your oral and overall health.